What does the surgery day look like? The day of surgery is game day. That's the day that you've been waiting for many, many years, that you've researched about. But sometimes it is normal to feel apprehensive about this day. And what I want to share with you is just what that day typically looks like. Generally, if you can sleep, you would wake up early in the morning, just in time for the driver to bring you to the hospital. At the hospital, you will be greeted by our friendly administration staff who will check you into the hospital. The nurses will do some basic observations and some basic pre-operative checks to make sure we are safe. And then the blood tests will be done. So we normally do a standard of a couple of basic tests to just check that the anesthesia is going to proceed according to plan. The anesthesiologist will also come and see you in the hospital to do the pre-op checks and make sure that you're safe for anesthesia. And at this time, we also discuss all the details of the anesthesia and what you can expect in terms of pain management and so forth. I will also visit you in the hospital to come and check that all the preparations have been done correctly and that we're ready to embark on this journey together. From the hospital bed, you will be taken to the pre-operative waiting area in the operating room. Interestingly, in South Africa, we call operating rooms theatres, so you will be going to the theatre, and there in the prep room, we will meet you again. This time I will have my scrubs on, and I will have a mask and a cap on, so I will look fairly different. And then we will take you through to the operating theatre itself, where in a matter of a few minutes, you will be put to sleep safely and we will embark on the surgery. Now, what happens during the surgery is essentially a very structured process where we follow very specific steps in order to make sure that we execute your surgery to the greatest level of care and the greatest level of safety. A big portion of that is sterility, so a big part of what we do is to prepare the operating theatre, to prepare the operating field and the staff to be in a sterile environment where we can prevent infection from occurring. The operation itself has different phases to it. There's the preparation phase, where we set everything up, we mark out the pre-operative plan on the patient's limb, and we make sure all the equipment is there. Then we have a phase of where we start doing venting holes in the area where the osteotomy is going to take place. This is really important to reduce the risk of fat embolism syndrome. And then we start by inserting the nail, and there are very specific steps which we follow to bring the nail into the bone. Once the nail is introduced into the bone, we also complete the osteotomy, the cut in the bone, which is going to be where the bone is grown. And this is done in a very specific way with a tool called an osteotome. Once the nail is then finally inserted, it gets locked with locking bolts at the top and the bottom. And this basically then stabilizes the nail in the bone. And once all of that is complete, we have the last phase of surgery, which revolves around testing the nails to make sure that they actually work before we take you out of the operating theatre environment. And then once the operation is concluded, we move you to the recovery area where specialized nurses will have a look at you and observe you very closely together with the anesthesiologist to make sure that you wake up safely and that you return from dreamland in a safe state. From the recovery area, you get taken through to the high care unit, which is what a lot of people call an intensive care unit. And this is really the post-operative ward in the hospital where you will be spending the first 24 hours. The reason why we do this routinely is so that we can monitor you carefully for fat embolism syndrome, which is one of the most scary complications of this whole surgery. And the reason why we put you in the high care unit is so that we can monitor you for your oxygen levels, and should those drop, we would be able to respond very quickly. And that is basically, in a nutshell, what happens during this first operation day, what we like to call game day.